Everyone, my name is Tremaine Perry Jr. and I'm here to present my final video project. Okay, so today I will be summarizing the evaluation plan summary that I've done on East Central Alabama Mental Health Center located in Tuskegee, Alabama and the Macon County area. So a quick overview of what I'm going to be talking about. So, the purpose of my evaluation plan was to assess how effectively East Central Alabama Mental Health Center meets the mental health needs of rural residents. My plan focuses on improving access to services, increasing engagement, and reducing crisis events in Macon County. Because this is a rural region with limited transportation, high poverty, and a small provider network, understanding the local content was crucial. So what I learned. One of the biggest things I learned during this process was how differently rural communities experience mental health challenges compared to urban areas. Transportation and stigma stood out as major barriers. I also learned how important it is to collaborate with community partners because no single agency can meet all the needs in a rural county. This project taught me the value of thorough planning and how data can guide better decision making. My plan summary. My evaluation plan uses a mixed methods approach. I incorporate both quantitative data like attendance rates and crisis call numbers and qualitative data information such as interviews and satisfaction surveys. I focus on three core areas: improving the access, evaluating service quality, and measuring client outcome. The plan also includes an analysis of how crisis services and community outreach support rural residents. Next one, major features. Some of the major features of my plan include the development of a strong logic model, the creation of measurable indicators, and consideration of ethical issues such as confidentiality and cultural responsive care. I also integrated feedback from stakeholders to make sure the evaluation aligns with the real needs of the community. Logic model highlights. So, my logic model outlines the structure of the program and guided the evaluation framework. It includes inputs such as clinicians, crisis team, telehealth technology, and funding. Activities include outpatient therapy, medication management, crisis response, and case management. Short-term short-term outcomes focus on improved access and reduce symptoms severity, while long-term outcomes include reduced crisis, improved functioning, and strengthening the community partnerships. Factors influencing the plan's development. The development of my plan was influenced by a number of factors. Local demographics showed a predominantly African American rural community with significant transportation and economic challenges. I also considered statewide mental health initiatives from the Alabama Department of Mental Health, such as expansion of mobile crisis teams. The rural reality shaped the goals and methods I included. Limitations. So, like any other evaluation plans, there are limitations. Data collection can be challenging in rural settings, especially when the agencies have limited staff or technology. Transportation issues can affect appointment attendance, which impacts the data accuracy. Another limitation is staffing shortages, which are common in rural mental health centers and can affect both service delivery and evaluation capacity. Future considerations. For future improvements, I believe expanding mobile crisis services in Macon County will help address emergency needs more quickly. Increasing telehealth availability will improve access for clients without reliable transportation. and continuing to build strong partnerships with schools, hospitals, and community organizations will support a more coordinated system of care. So, in conclusion, creating this evaluation plan helped me understand the complexity of delivering mental health services in rural Alabama. The plan promotes um, equity, it strengthens service assets, and supports data-driven improvement. Overall, this project prepared me to think critically about developing effective and culturally responsive programs for underserved communities. That was my presentation. Thank you guys so much for watching. I hope you guys kind of got an insight on what I want to focus on, what I want to pay attention to, because I am from a Tuskegee. I know what they're lacking. They've been lacking for years, and this is before I was born, when I was born, and after. So it needs to be some real change when it comes to mental health because the city um, is hurting for these services. So if I think this is a start. With me with the resources focusing research on untreated mental health in rural areas, and I can utilize where I'm from. So thank you for watching.